Riley Dawson. Is she all right?
That depends. Who are you?
John's her boyfriend.
And have you notified the family?
She's in foster care, but I don't think that we should call them. I think something's up. Something bad.
I see. Well, by law, I have to place her under a 5150 hold for the next 72 hours. CPS sends a caseworker out to evaluate her home situation, and they make the appropriate judgment. You're gonna need to just stay put until CPS arrives.
Is everything all right?
I was about to ask you the same thing. She's missing. We're locking down the hospital and we're searching room by room. Do you have any known food allergies to egg products? Dairy, maybe? No, okay. Let's move on to lunch. Can you tell me what William had for lunch that day? I know it's a little bit hard to remember, but please think back as best you can.
It might have been leftover lasagna.
Might have been. Okay, well, what about for dinner?
Yeah.
What is that over there?
Well, that's a burrito. He likes...
He really needs to get... The food is just too heavy for him at this time, home-cooked
Well, I
food.
could fix something lighter, because he doesn't like the hospital food.
I'm sure your food is very good, but I would really like to have him just stick to the hospital food for the next couple of days so we can monitor what he's actually eating. In addition to that, I would like to go ahead and order some routine blood tests. Since nothing showed up on the endoscopy, I think that's an appropriate next step. Now, that's going to mean that William is going to need to stay in the hospital with us overnight. And I think it's good for him to do that, to stay with us for that period of time, rest, get some of our food, and we'll do the blood tests as well. Okay? And I'll be back with you soon.
Thank you.
What do you have for us tonight?
A bit of a puzzler. I have a 2-year-old that appears to have a great deal of pain in his legs. He won't stand on his own. He won't stop crying. Extreme sensitivity to touch.
We're going to do a full workup. Let's get blood, x-rays, everything. Also, I think we should call the social worker.
You think they're harming the child intentionally?
I just don't think we can rule it out yet. Well, I'm not ready to rule out parental negligence yet, but did you see the way they looked when they drew his blood?
Like it hurt them more than it hurt Austin?
Yeah, not exactly the kind of behavior you would expect from abusive parents. And why is he so anemic? Why are his gums swollen like that?
Some sort of myeloid disorder?
I hope not.
Can a child subsist on oatmeal alone?
Not by itself.
Do you think it's possible? It adds up. Mr. and Mrs. Self, this is Mrs. Alvino. She's a social worker.
I don't understand. Did we do something wrong?
Don't worry. I just want to ask you a few questions about Austin's home life.
Hey, Austin, can I get you to stand for me? Let me help you out. Come on. Can you walk for me, Austin? Very good. That's great.
If you knew there was a situation, why didn't you call me sooner?
We didn't think Mr. Spencer could have gotten that far. I called you as soon as I could.
I don't want to hear excuses. You find Luke. Yes, what is it?
Dr. Moore is here.
I was going to call you later. I trust our patient is resting comfortably.
I'm afraid I have some bad news. Luke Spencer escaped the facility a few days ago.
Nurse, please call the other doctors. They have to see this.